Making sense of clinical quality reporting, how to move forward with electronic reporting. This is number 3 in a series of presentations we did in June of 2016. There is closed captioning available at the bottom of your screen. If you need it to be larger so you can see it better, there is a small arrow in the middle bottom portion of your screen that you can click on to make it bigger. Health Technology Services is a department of Mountain Pacific Quality Health Foundation. Mountain Pacific is the Quality Innovation Network Quality Improvement Organization for Montana, Wyoming, Alaska, and Hawaii. We help facilities simplify and streamline quality reporting, stay current on changing regulations for meaningful use, PQRS and MACRA, simplify HIPAA compliance, and help facilities advance and leverage EHR usage to advance care delivery, enhance patient engagement and satisfaction, and improve health outcomes to maximize value-based performance payments. This presentation was current at the time that it was published and uploaded to the website. Medicare policy changes frequently, so please be sure that you are aware of new policies in relationship to the date that this presentation was uploaded. I am Mary Erickson. I have been a registered nurse for the last 18 years, with the most recent 10 years spent in risk management, performance improvement, and hospital operations. I work with hospitals and clinics on various improvement projects, from electronic medical record implementations to CMS readiness. Our goal for today is to review some recommended steps to help you get started with electronic quality monitoring and reporting for improved efficiency in your organization. And just as a point of clarification, today we are strictly referring to our clinical quality measures associated with meaningful use. We are not going to discuss the core objectives. These are 2 different sets of requirements that are both required for meaningful use. If you have any questions about the core objectives, please contact us. The connecting link between clinical quality reporting and meaningful use quality measures is electronic clinical quality reporting. First, let's briefly review the difference between CQMs and electronic CQMs. CQMs are an additional set of measures that are defined by CMS to measure quality, and they are reported manually through the meaningful use attestation process. You must use the certified technology to generate a CQM report and submit the data to CMS. And then be sure that you retain this report for meaningful use audit purposes. Electronic clinical quality measures are the same set of measures, but not necessarily all are available to report electronically. The data elements that are defined in the electronic measures are defined by CMS. You are required to use your certified technology to generate a CQM report, extract the data into a quality reporting data architecture format, and then upload that file electronically to the CMS portal. eCQMs are clinical quality measures reported directly from the EHR to CMS. Manually entering data into an online cart or data abstraction tool is not considered electronic reporting. An eligible professional, hospital, or critical access hospital must use the most current reporting period version of the eCQMs. These are updated annually, and they are available at the eCQM library website. The 2016 QRDA implementation guide is currently available. They make the specifications available 6 months prior to the start of the next reporting year. So what do you need to do to move forward with electronic reporting? First of all, set some goals. Set the goal of achieving electronic clinical quality measure reporting so that you can focus your improvement priorities for value-based purchasing success. You can focus your facility and vendor efforts to address issues affecting reporting capability, such as poor EHR workflows, broken report mapping, certification of missing measures, low-end user satisfaction and poor use of the system, and lack of internal report availability and control. In order to get started, start using and generating your clinical quality measure report. Understand the data that's contained in the CQM report by familiarizing your organization with the measure specifications that are available at the eCQM library. Next, obtain EHR-specific workflows for the CQMs from your software vendor. When these reports were programmed and when these software was designed, it was designed with a workflow in mind. And if you're using something different from that workflow, your report may not reflect accurately the care that you're providing. Validate the data contained in the report, which is what we're going to talk about next. How to validate your data. You're going to work a little bit backwards than normal. You're going to go from your report backwards to the data so that you can essentially find out if what you are seeing on the report is reflective of what's actually being done in practice. So first of all, run your report. Secondly, run the patient list that goes with that report or that specific measure, and make note of who met the denominator and who met the numerator for that measure. Next, go to your chart. Find where the information is that the staff charted regarding that measure. Find the information, write down specifically to the data field that supports that measure or that measure in that report. And then talk to your staff. Do they typically document there? If you're not seeing it there, then you may need to ask them and discuss with them about where do they typically document that information. And then ask yourself, does the report reflect what you found? Does it reflect that if your staff are reporting the information in a different area, for example, nurses' notes, instead of reflecting a fall score or fall assessment score in the fall assessment tool, then the report is not going to reflect the fall assessment score if information is not reported in that field. So then you just start this cycle again and again until you find the data elements that you're looking for, where they're documented, and how that contributes to the report. Now put that validation process together with the QI concepts that you already know in order to improve your ability to align and report your quality measures more efficiently. The clinical quality improvement process that we utilize is as follows. First, identify the problem statements and choose a project team. Create a change backlog or a list of changes that you're going to make to improve the outcome measure, and prioritize those changes based on the value of each change. Create the change backlog items to be included in your first PDSA cycle or Plan, Do, Study, Act cycle, and then plan when you're going to do your PDSA cycle and perform a workflow analysis of the workflows that contribute to those changes. Complete your Plan, Do, Study, Act cycle and perform a PDSA review. Then you will need to review and update and reprioritize your change backlog to begin your new PDSA cycle. And documents to support this quality improvement process are available on our website at go2hts.org under the eCQI resources section. In conclusion, electronic reporting is the motivating factor to moving healthcare forward in the use of EHRs as tools in our organizations. If you need additional references and resources, we've listed several links on the next two slides. The first one is 2016 Meaningful Use Program Requirements and the eCQM Library Start page. This is where you will find all the specification sheets for the electronic measures to help you identify the necessary data elements for your report. The Inpatient Quality Reporting Electronic Checklist is available at the link here, as well as the AHRQ Health Information Knowledge Base, where you can submit feedback on proposed measures for future rulings. There is also an electronic clinical quality improvement resource page available through healthit.gov. My contact information is here if you would like to contact me about anything you saw today, or for more information about eCQI, please contact myself or someone at HTS. Thank you for listening.